Hi everyone, welcome to the Aesthetics and Wellness podcast by Dr. Yusra. Today I am joined by my right-hand lady, Sophie, and we are talking all things complications. We're talking about safety in aesthetics. We're going to dispel the myths that you might have in the back of your mind about Botox, dermal fillers, explaining to you the difference and safeguarding you so that you can choose the right practitioner and also the right filler for your treatment area. Let's go.
Thank you so much for having me on today.
Thank you for coming.
Thank you. So I think the first thing to sort of clear up for everyone is what is a dermal filler and what is Botox?
Great question, Sophie. So there is a difference between dermal filler and Botox. I think a lot of people think they're one and the same, but they're not. Dermal fillers are injectables that replace lost volume or can create volume. And they can be made from hyaluronic acid, which is naturally present in our tissues, or they can be made from calcium hydroxyapatite. They can be made from various different ingredients, so they're not all the same. Different dermal fillers can be made of different constituents. They can come in different densities. So you might have soft filler molecules that are best suited to, say, the under eye, or can be used to replace lost hyaluronic acid in your skin. Or that can be used to create, a chin, or cheek augmentation or restructure a nose. So there are thick dermal fillers, there are soft dermal fillers, but by nature, they are injectable implants that are usually biologically stable if they are hyaluronic acid. And hyaluronic acid is essentially a sugar molecule. It's a sugar molecule that comes from the fermentation of Streptococcus bacteria. And hyaluronic acid are the most commonly utilized ingredients for injectable fillers or dermal fillers. Nowadays, we call them soft tissue fillers because they're not just placed in the dermis, they can be placed on the bone. So that's it. That's a dermal filler. Botox is a brand name. Okay, so it's a brand name for, again, an injectable that's a neurotoxin. It's known as botulinum toxin type A. Now, this is a prescription-only drug, which means you should really only get this from a doctor, a dentist, a nurse prescriber, a pharmacist prescriber, essentially a medical practitioner who's licensed and regulated because it's prescription. So you can't buy it off eBay. You certainly shouldn't be buying it off a man in a white van. And it is a drug that must be prescribed for exclusively the use in your face or on your body. And it is a drug that has medicinal properties, so it can be used for a range of different ailments, and it can also be used for wrinkle relaxation. So there are different brands of botulinum toxin type A. Botox is one of them, but there's various different brands, including Azilor, Dysport, Illusience, Nucivia, Bocature, Xeomin, so the Letibo. There's various different brands on the market and more coming. So it is a rapidly expanding market. And the way that it works, the reason why we call it a neurotoxin is because it works on the nerves, and it stops the nerves from sending out a signal to the muscle to contract. So it stops a specific neurotransmitter called acetylcholine, blocks that, so that nerve can no longer send a signal to the muscle to contract. And by doing so, it temporarily stops that muscle from contracting, which, for the very reason that it stops the muscle from contracting, it can be used to improve the appearance of lines and wrinkles of the upper face. It can be used for the lower face. It can be used in a range of different areas in the body. For example, botulinum toxin can be used for spasticity. It can be used for people who have migraines. And I know that you have this treatment for migraines.
Yes, I do. I also have it here as well, which really helps.
Yeah.
After my last batch has really helped me stop grinding at night. I'm not in as pain when I wake up.
Yeah.
So it's something I would recommend for patients if they're grinding, if they have migraines.
Yeah.
That for me is the only thing that's had a real difference.
Yeah. So it's commonly used in the jaw. Some patients, they grind their teeth a lot like you.
Yeah.
So, and you suffer from really bad migraines, don't you?
Yeah.
So again, this is another thing that not all dermal fillers are the same, and not all botulinum toxin type A's are the same. Some of the botulinum toxin type A that is available, the different brands, have certain licenses. So some are used or have the license for use in the body. Some have the license for use, for example, to stop sweating. So some people get excessive sweating called hyperhidrosis. So they can use in the hands, in the underarms if they're getting, really wet and sweaty under their arms. They want to stop the odor or the wetness there. And then some people have it for muscle tension, like the migraine. So they have it in the upper face. They might have it in the back of their neck. They might have it to reduce. We've heard about Barbie Botox, which is, I mean, I've got my opinions on that. We can talk about that. Trends and fads in the industry. Some people use it for relaxing a muscle in the jaw. So if you're grinding a lot, then that muscle called the masseter muscle, which is a jaw muscle, it's constantly working. And if you're grinding or clenching even as you sleep at night, which I think, Sophie, is what you were doing.
Yes, I was waking up in the morning with a very sore jaw, and you question, is it toothache? Is it a headache?
Yeah.
What is it?
What is going on?
And I know my other half is renowned for grinding his teeth at home. It wakes me up, and like last night, for example, 5 o'clock, woke up by his grinding.
Really?
Yes, really severe.
So
I don't know how he's not in pain.
Yeah.
Because it's loud.
So a lot of patients don't know they're doing it. It's completely subconscious. So he's unconscious. He's asleep. He has no idea he's doing it. Kind of like snoring, which is a whole other podcast. But it can be really annoying for the partner, but also it's very detrimental for the health of the patient because if you are grinding, that muscle is getting larger and larger and larger, kind of like bodybuilding. So this muscle is going to the gym at night when it should be resting. That muscle is getting larger and larger. Therefore, it's becoming more powerful. So now you've got hard on hard, tooth on tooth, grinding each other. That increases the risk of developing fractures in the teeth. And they can be tiny hairline fractures, but that can result in chronic pain. It can also result in losing a tooth. So if you have a fracture that goes all the way down the root, that tooth is gone forever, and teeth are expensive. So you want to hold on to your teeth. So we do use botulinum toxin to stop or reduce the grinding, reduce the muscle mass. Sometimes it's used cosmetically to slim the lower face as well, because as you're grinding, particularly in women, it can masculinize the lower face. It can make the face look larger. So it's used to kind of make the face look slimmer. And then for lines and wrinkles of the forehead. And we can also use it in the lower face to lift the face.
Okay. What about, I know a trend that's come out, we've had lots of inquiries about it being used in the lips. Can it be used in the lips? What effect does that have? How does that help?
Great question, Sophie. So you're talking about the lip flip, aren't you?
I am.
We get a lot of questions about this at the clinic, and yes, it is a treatment that I do at the clinic, but I'm very selective about it, and I'll tell you why. So there are, like we were talking about, certain brands have certain licenses, which means that when we are using it off license, it's called an off license use or off label use. Now that doesn't mean you can't use it, and as doctors, dentists, nurse prescribers, we have clinical autonomy to prescribe the right medication for the patient, even if it's off label or off license, but it's a discussion to have with the patient. Now, lip flip is an off-licensed treatment. And essentially what it means is we use the botulinum toxin injected into the lip line, the upper lip line, sometimes the lower lip line, to stop smoker's lines. So when patients are pursing their lips or at rest, sometimes they find that they've got these vertical lines on their upper lip kind of bleeding into the skin up here. And that can result in lipstick bleeding. Sometimes they don't like the look of it because they feel like it makes them look aged or older. And lip flip can also be used to flip the lip upwards and outwards, which gives a more voluminous look. Now, my advice is approach this with caution. It's not suitable for all patients. And also, bear in mind, botulinum toxin type A only lasts 3 months.
Yeah.
There are newer neuromodulators or newer neurotoxins, newer anti-wrinkle injections that can last longer than the traditional 3 months. Now we're seeing longevity lasting up to 6 months.
Yeah.
But if you are stopping the pursing of the lips, you're not going to be able to kiss.
Yeah.
Right. So you can't blow a kiss. You're not going to be able to drink through a straw, and you might not be able to say certain letters or pronounce certain letters like P or S properly, because that requires a pursing of the lip. So if you can't purse the lip together, you might sound a little bit funny. So it can impede speech. So I would say, listen, approach with caution. Bear in mind it only lasts a few months. Lip filler can last several years, in fact, and may be a better option for patients. And of course, it's not one size fits all. I can't give blanket advice. When my patients come in, I will assess them and choose the right treatment for them. But yeah, it's certainly a treatment that has gained popularity because of the World Wide Web and the Wild Wild West of the World Wide Web. And there's a space for it, but I think it's not for everyone. And there's certainly side effects that can really impede function. So I would say approach with caution.
Yeah, definitely. I think that's something for everyone to be aware of when we talk about it in clinic. I know when I've been on the phones, patients or dealing with inquiries, patients maybe have this one set treatment in mind that this is what they want. And I know we see that in clinic and they can often feel really disappointed. But I know from being in clinic with you that you're not gonna do something that isn't right for that patient. So I think that's really important for when patients come in open-minded. It's great because they're really willing to take on the knowledge. So that would be something I say to patients. If you come in open-minded, that's when you're going to get the most benefit, because that's when we can help you the most. And if you're not set on one treatment, we can help advise you.
I think that's really important because, any monkey can inject. Mm-hmm. And when we are injecting a foreign body into the patient, and ultimately both dermal fillers and botulinum toxin are foreign bodies, there is a responsibility. I hold a responsibility before injecting the patient. So I need to know that when I'm doing a cost-benefit analysis or a risk-benefit analysis, I'm not putting the patient under undue risk. And actually, I'm fully explaining all of the potential side effects, the risks, and that they're making the right decision for them, because not everyone knows. You look at Barbie Botox trends online, and hey, I want a nice long neck and a slim shoulders. Everybody wants that, but especially after the Barbie movie. And I get it. I get that that's what they're seeing, and that's what's driving them into clinic. And I think as responsible, ethical medical practitioners, and this is the ethos that we have in the clinic, and what I say to all of my staff, as you know, and our doctors, is the treatment plan is a joint agreement between the doctor and the patient. We have to listen to the patient, but it's vital that we guide them, and also that we are cognizant of their sphere of influence. Yeah. Because there's all kinds of things on the web. There's all kinds of trends and fads come and go. And we have to be able to sift through the noise and advise patients what's in their best interest. So, that might bring them into clinic. They might say, well, I've seen lip flip on Instagram, I want it. Without understanding that it's going to affect their speech, without understanding they might look a little bit funny, without understanding that it can mean that they can't kiss properly. So it's important that they fully understand the outcomes and the risks before going ahead with the treatment. Yeah,
I know that's something we definitely see. We deal with complications that aren't our own patients, that come to us for help, that have been to a clinic, maybe a beautician's done it, who's had a 2-day training course. Yeah. And they're coming to us with not being able to pierce their lips, and they're thinking something is wrong. So I think knowledge is power ultimately, and it's really important that we give the patients that knowledge to take away. We offer the cooling off period. No patient is forced into treatment. Yeah. Patients have their own autonomy and they have to make that decision. So I know as a clinic, that is really important to us, and we always say to patients, like, it is your choice. We're not going to pin you down and inject you. That's not who we are. That's not what we do. It's very much their choice. So I know we like I just said, we see lots of complications. What would be a complication to a patient? We do get calls from patients. We get inquiries concerned that maybe what they have is a complication, and we know it's not a complication, it's a side effect. So what would be the difference between the two?
Great question. I think there's two answers here. Number one, there's complications associated with fillers, and then there's complications associated with botulinum toxin. So let's talk about complications with fillers. When we are injecting anything into a patient, when you are piercing, you're using a needle, you're piercing the skin, we are essentially injecting human beings. And these walking, talking human beings have blood vessels, and these blood vessels are keeping them alive and keeping their skin nourished. But by virtue of that, sometimes one of those blood vessels can be pricked during an injection, which means that they may bleed, and if they bleed, they may bruise. So bruising is a not so uncommon risk or side effect of treatment. And I think it's very important that patients are aware of that, so that they can schedule their treatments in a reasonable time period. If you're getting married the next day, perhaps not the right time to have a treatment. You need to leave a gap between having a treatment, because it's unpredictable. We don't know who's going to bruise. And certainly we can use techniques that will reduce the risk of bruising, and bruising is very rare. 9 out of 10 of our patients don't bruise, but that one patient that might bruise, it can be distressing for them. But bruising is a risk, but it's not what I would call a worrying complication. It's transient, it goes away, it's human, it happens.
And this is the importance of what we say to patients: book in advance for events. We often have patients phone in and get married next week. And I'm honest with them. I'm like, look, it's not the right time for you to come in. If you have bruising, if you have any swelling, if you simply don't like the result, which can happen, there's no time to fix it. And
absolutely.
It's big as day.
Again, it comes down to professional integrity. And you guys are so amazing at the front desk, and you look after the patients so well. And we're very ethical and tell our patients straight up, if you're getting married the next week, it's not a good idea to have an injectable treatment because yes, there's a risk of a complication. Nobody's got our complication rates are so low, and I'm very grateful. We've never had a necrosis or a blindness or any of the scary stuff happen. But of course, we've seen patients bruise. The last thing you want is your patients to be swollen and bruised turning up to their wedding day. So create a good gap between having treatment. And I say injectable treatments are best scheduled 6 weeks before any major life events, just to allow that time for the skin to settle, swelling to settle, any bruising to settle. So swelling, bruising, they're transient. They can happen. They're risks of any injectable treatment and not necessarily something that I would worry about. I would just say, obviously, if you've got an important event, just be sensible and create a gap. And if you're getting married the next day and you want to look amazing, come and have a skin peel or a hydrofacial. There's other things that we can do to give our patients a zhuzh without putting them at undue risk. In terms of worrying complications with dermal fillers, in my opinion, these are medical treatments. Now, the problem is our industry in the United Kingdom, if you're listening from the USA or elsewhere, you're probably in a much more regulated environment. But in the United Kingdom, it's one of the worst for regulation, which means a plumber or a builder can go on a one-day course and start injecting filler into your face bought from eBay. There are over 400 different fillers in the market in the United Kingdom, only about 20 in the USA. So there's a huge difference. And not all dermal fillers are created equal. They're not all the same. Some have gone through rigorous testing, rigorous research, and we know that they have a very high safety profile and a very low risk profile, and their bacterial load is low. So as you know, we only inject the best in the clinic, but infection is a risk. So if you're not using a good filler that has been well tested, if you're not injecting in a sterile environment or as near sterile as possible, if you're not cleaning the skin, if you're wearing makeup, if you're putting makeup on afterwards, there is a risk of developing an infection. And that is something that is really worrying and can be really distressing and can be difficult to manage. So infection is a risk. It's a very, very low risk. In my lifetime, having done this for over a decade, treating tens of thousands of patients, I have seen 2 infections in my lifetime. But they are difficult to treat.
Yeah.
So I'm strict. No makeup afterwards, no touching afterwards, and that is how you'll get the best results.
And we're strict I know we have had patients come in with makeup on and they've said, I'm going to get my nose done.
Yeah.
But no, it's really important to take it all off because it travels in the skin.
Yes.
We're doing that to protect you, not because we want you to take, not for the fun of it. Yeah. We want the best for you. We want you to have the safest possible treatment. So yeah.
And I get it. Like I'm wearing makeup now, you're wearing makeup now. Everyone wants to look their best and they want to come to clinic wearing makeup, and I get it, and it's fine, but we will always take it off to safeguard our patients. And then if you want to wear a mask on your way home, by all means, we will supply one.
Yeah.
The other thing that I think is important to talk about is the very rare but serious complications. And now we're talking about vascular occlusions. And this is something that can be really distressing for both patient and practitioner. And a vascular occlusion essentially is if filler is placed in a blood vessel or next to a blood vessel, it can block the blood supply to the skin. And if it blocks the blood supply to the skin or causes a spasm of the whole tree, so blood vessels act like a network.
Okay.
So a blood vessel down here might have various different branches, kind of like a tree, and it supplies various areas of the face. So if that entire blood supply is blocked, then the whole region that blood vessel supplies will stop having a blood supply. And that means that the skin will not have nourishment, oxygen, and essential nutrients for survival, and can undergo a skin breakdown called necrosis. And if they undergo necrosis, it means the skin can literally slough off. It can become black, it can become infected, and it can result in permanent disfigurement. Now, again, this is not something to panic and run a mile from. And I deem fillers to be very, very safe, done in the right hands. And the importance here is if, God forbid, a vascular occlusion does occur, that it is picked up promptly, that the patients are empowered with understanding and looking out for the right signs and symptoms and getting care quickly. Yeah. So we have time. We usually have, we've got 24 to 48 hours, even more, up to 72 hours to reverse a vascular occlusion and stop it from becoming a full-blown necrosis. But the sooner you get treatment, the better. And left untreated will result in permanent disfigurement. The other, again, very rare risk, but serious complication is blindness, permanent visual loss. Now, there are areas that are particularly high risk, like the nose. And as you know, I specialize in this area. I do noses every single day in, day out for several years.
That's what you're known for. You are known for your noses.
Yeah. And people often ask, why did you choose noses? It's so high risk. And I say, well, I didn't choose it. They chose me. But, it's a procedure I love doing. It is life-changing. It is so empowering, but it is not to be taken lightly. No. It is not to be done, don't dabble in it. Get it right. Go and see a practitioner who is really focused on the area and does a lot of them, because the vascular anatomy is complex and there is what we call connection. It's known as an anastomosis between the internal and external carotid artery, which means the blood supply that supplies the outside of your face and the blood supply that supplies the inside, i.e. your brain, i.e. your eyes, are connected, and the area of connection is right here at the top of the nose. So it's a very high risk area. And if, God forbid, filler gets into that, it can result in permanent visual loss and it can result in a fatal stroke. So that's quite scary.
Very.
And thankfully, it's never happened in our clinic before. And there are techniques that we use and ways that we can mitigate and reduce the risk. But we're not God. I don't know if it could happen tomorrow. So it's vital that we use every single tool in our toolkit to reduce the risk of that happening. And we can talk about what those techniques and tools are. And again, this is not to scare patients, but it's to understand that these are serious. And again, I put it in perspective for my patients. I explain to them, this is something you need to be aware of that can happen. But it can happen in the nose, it can happen in the lips, it can happen in the tear trough, it can happen in any area of the face. And in fact, there have been over 200 reported cases of permanent visual loss in the world. Okay, so globally, not in our clinic, globally. But if we put that in perspective, that's something like 3 in a million. There are millions of these procedures happening every single day all around the world. So it is very, very rare for this to happen. But again, part of our duty of care is having this sometimes scary conversation so patients can make an informed decision.
Being honest is the be all and end all. And I know patient safety at the clinic for us is the most important thing. That's why we talk about the medical history. Have they had treatment before? If they've had treatment before at another clinic, for example, that's maybe not regulated, they don't know what's been used, we definitely, approach with caution. We're not just going to say, right, fine, lie down. That doesn't happen.
Stick it in. No, we don't. We definitely don't just do that. I came from a surgical background, and I remember when I was consenting patients for head and neck surgery, my conversation was even more worrying. So it was, you might not wake up from a general anesthetic. When you're put to sleep, there's a risk that you won't wake up. Now, it's very rare these days because safety is so much better when it comes to anesthetic, but that is what constitutes informed consent. And this episode about complications is not to scare patients, but to empower them, because knowledge is power. And if you understand the risks, then you can make the right decision for you. Fillers might be right for you, surgery might be right for you. Everyone is different. And ultimately, whenever I am seeing a patient or treating a patient, I will make a risk-benefit analysis. I will have a look and I will decide, is the risk worth it? Will the benefit outweigh the risk? And if it doesn't, then the answer is no. And that is to safeguard them.
Yeah. And I think our patients they're grateful for that. I know as they've been leaving, I've been sort of checking them out. Yeah. They're like, I'm so glad that I've been here. Yeah. I've spoken to Dr Yusra and she's given me her honest answer. Often our patients travel to us. They come from all over the country. They said they could have come.
All over the world.
Yeah, all over the world. They say, I could have gone somewhere locally, but I'm so glad I came here, because we are fortunate to have the ultrasound. And I don't know lots about it, but I know that we can use it. We use it pre-treatment. We can use it post-treatment. We can use it to check for complications. Yeah. Some patients come to us purely for an ultrasound. They're nervous to have the nose done. They're nervous to have tear trough done. So we can use that to, number one, check that it's safe to do so. And number two, to put them at ease, which I think is really important for patients.
I couldn't agree more, Sophie. I think ultrasound is one tool. It's one tool in our toolkit that has elevated patient safety. Yeah. And my sister describes this well and says it's like having a seatbelt. So you can drive a car, you can have a roadmap, you can still have a car accident. But if you put your seatbelt on, you're an added layer of safety to reduce the risk of a complication. Yeah. So an ultrasound essentially enables us to see what lies beneath. None of us have X-ray vision. And anatomy textbooks lie. And that's why you can't learn anatomy from a textbook. You need to learn anatomy as we do in medical and dental school. Dental school is so in-depth head and neck anatomy. I know my father's a surgeon, my husband's a doctor, a medical doctor. The medical anatomical training of dental surgeons in particular is profound and deep, because that is the forte, that is the area that they focus on. And from dissections to treating live patients surgically, that is how you learn anatomy. And what I know from doing so many dissections and being involved in multiple patients' surgical treatments is no two faces are the same. So textbook anatomy is not true. There is a 20% variation. Your blood vessel is not going to be exactly where my blood vessel is. So we can think, we can plan, we can predict, but I don't know where your blood vessel is underneath your skin. And that is where the value of ultrasound comes in. It enables us to visualize, to map. We call it vascular mapping, and create a roadmap. And if we can see the blood vessels, then we can work around them, we can avoid them, and we can plan a safer treatment. So that's what ultrasound affords us pre-treatment. And of course, ultrasound can be used for complication management as well. But certainly, as you said, we have patients coming from all over the country, all over the world. And I think what I find is, and I hate saying no to patients, but I think it's important. Yeah. I think it's vital it comes down to professional integrity. Yeah. I'm not just going to stick filler in your face or fill you like an eclair wherever you want it, because it might not be in your best interest. And, when I started out, when I first moved to Liverpool, and I talk about this a lot, it was very palpably different to when I was in London. As you know, it's kind of the bigger, the better. The faker, the better sometimes. I think the tide is shifting, but that was certainly what it was like 7 years ago. And I
know, like my sister, before I started here,
I
hope she won't mind me, she's not got any, she's not had any treatments done, but I remember her and my cousin were looking at, or I may have just started looking at a local beauty salon who I think was doing 2 mil of lips for like £150. And I was like, you go there and there's trouble.
Trouble?
Yeah, like
don't do it.
Yeah, like it's just, and it was a beauty. I was like, it's just a beauty. She doesn't know anything. She's just going to inject where she feels like inject. It's almost like me going in and saying, wait, I'll inject. Yeah. That's I'd be 100% less likely to do it now after seeing what can happen. Like I wasn't, before I started with you, I had no idea. No, you just saw the big lips, the big eyebrows, essentially, the really full cheeks. That's what Liverpool was known for at one point.
Here's the thing, is patients don't realize the risk. They don't really understand. They don't know that you can go blind. They don't understand the risk of vascular occlusion. They don't understand migration. They don't get all of these things. And migration is something different. It's, migration is where too much filler is put in, and it ends up spreading and causing distortion to the natural anatomy. And therefore, the lips are not moving naturally, and it looks really quite off-putting. And I remember when I had first moved where I was working, I would often be quite taken aback by the size of the lips that would walk in before the rest of the face. And I would say to my patients, look, this isn't a good look. But patients can only see a 2-dimensional image of themselves. You see me, Sophie, in a different way that I see myself. I only see myself in photos in a mirror. You see me in real life. Yeah. And I therefore don't appreciate really how I look in all angles, right? Yeah. I see myself when I'm smiling or looking straight on, non-animated, non-speaking in a mirror. Nowadays, I can see myself when I'm speaking because of all my videos. But people don't see that usually. So they don't appreciate or realize what they look like. And if their friends look like that as well, that becomes a new norm. And again, it's something I call perception drift and aesthetic blindness. They get used to how their friends look, and it becomes a culture where you need to have more in order to fit into the culture. And that's the social media peer pressure era that we've been in. But I think, with social media comes good and bad, and people were, I think, pulled into having lots of filler in the past, and now they're recognizing that actually less is maybe more. And certainly, like I said, when I first started, there was a heck of a lot of filler put in where it wasn't aesthetically pleasing. And I would often be told, well, if you don't do it, I'll go to skin clinic down the road and they'll stick it in. And I'd be like, listen, that's fine, but it's my reputation on your face. And then they'd go home and they'd tell their friends or their parents or their moms or their aunties that I'd said no. And the aunties, the parents, the friends would come in and say, oh, thankfully, finally someone said no to her. And they'd come in and actually they'd have treatment then. And so I'm not afraid to say no. And it comes down to professional integrity. It comes down to assessment, being artistic. Pay peanuts, get monkeys. I do have a waiting list. You're right. I've got a waiting list. Sometimes patients have to wait several months to get an appointment. But a good practitioner is often booked up in advance. An experienced practitioner will have built up their reputation there in their patient list, and there will be a waiting list. But you have one face, right? You have 10 toes. I personally wouldn't go to a plumber that took a 1-day course in doing podiatry and go and ask them to do something on my toes, even though I have 10 of them. So if you've got one face, just invest in the best. Yeah. You're not one of the most dangerous things you probably can ever do is cut corners with your face. Yeah. And if you can't afford it, do not get it done. Save up and get it done right, rather than compromising your health. And often paying cheap means paying twice. And you and I have seen this so many times with patients coming in saying, oh, I had lip filler down the road for £100, and they're full of lumps and bumps. They've had a cheap filler bought off eBay. Often they've shared fillers with their friends or shared needles with their friends. It's really quite catastrophic and worrying. And when infections happen or when complications happen, the beautician down the road who did it, and I love my beautician, I can't do eyelashes, I can't cut hair. And I certainly won't pretend that a 1-day course in cutting hair will make me an expert in hair cutting, right? Like, I wouldn't go and pretend that I could build someone's house because of a week-long course that I've done on house building. So appropriate medical knowledge, rigorous training is vital to safeguard your well-being and your health and safety. And, this doesn't mean complications can't happen in doctors' hands, dentists' hands, medical practitioners' hands. Of course they can. But the idea is that a medical practitioner will be able to properly assess the anatomy, mitigate the risk by using safer techniques, and recognize and diagnose properly, quickly, and deliver complication management if, God forbid, the need arises. Yeah.
Doctors and medical professionals have the tools to deal with a complication. We know that one of the tools is a prescription-only product that isn't accessible for everyone. So if you are going to maybe not the right person, they don't have that in their toolkit to help you with, which I know is why we do see a lot of patients come to us who have been to people who don't have that, and they're having to come to us because we have those tools to help them.
I think one of the saddest things is if you have had a complication and the practitioner who performed it can't hold your hand or look after you. That complications happen in anyone and everyone's hands. If someone tells you that they haven't seen complications, they're either not done enough or they're lying. Again, it comes down to professional integrity. So we have had complications, and I've opened my clinic up in the middle of the night sometimes with kids in tow, sitting in the waiting room while you're looking after them, and I'm helping out patients who have been blocked on Instagram by their treating practitioner because their treating practitioner is not medical. And this is, I guess, a public health and safety message is, don't be fooled by social media, because anyone on social media can put on there medically trained and qualified and insured, and actually it means jack all. Yeah. And it puts the public at risk because they think they are misled into thinking that this is a medically trained practitioner. And of course they're not. And when a complication arises, they cannot get their hands on the antidote for fillers. Dermal fillers made out of hyaluronic acid can be reversed with an enzyme called hyaluronidase. And this enzyme is a prescription-only enzyme. So it can only be prescribed and administered by a prescribing medical practitioner. So, again, I think that's an important thing is patients need to know that so that they can choose. They can do their research. And it comes down to the patient to do their research and choose a regulated and appropriately trained medical practitioner.
Yeah, and I know that's something I've had conversations with patients on the phone. They simply cannot get to us. They may be completely, in a different country and they often go, who do you recommend? Yeah. I always say to patients, do your research, make sure you're going to someone that is medically qualified. Number one, that is my first piece of advice to them, because ultimately, if you're just going, if you are in a different country, you're not going to come to us to help fix your complication. That's a flight away.
Well, Soph, I remember, I don't know if you remember this lady she couldn't get an appointment with us. She was waiting for a long time and she got impatient. So she went to Kurdistan.
Yes, I remember her. I remember.
And she had filler and she had botulinum toxin. Yeah. And she had devastating complications and then had to come back and obviously pay twice as much to try and reverse it and fix it. And this is why I say pay cheap, pay twice. Yeah. So don't be tempted by the cheap deals abroad or try and get a quick deal when it comes to your face. Do not Groupon your face. You've only got one. I think that's the take-home message. Yeah.
That's why we don't discount our treatments, our medical treatments, and patients will often ask why. Because the medical, we're not going to discount something that ultimately would be wrong to do so. We're not just trying to fill you up like an eclair, as you often say. We're wanting to and it's bespoke for every patient. Like I know in the clinic we have a range of products. It's not a one size fits all. Every patient isn't coming in who's going to have the same product.
I'm like, this is like one of the things that I talk about a lot. Yes,
definitely.
I think again, it comes down to professional integrity. You know, you wouldn't go to your GP and expect that they prescribe one painkiller for every single patient. It's ridiculous. And I work with a range of different pharmaceutical companies and companies that make phenomenal dermal fillers. But it's vital that I have the right experience with a range of different tools, because my patients come in all shapes, sizes, and colors. And what might be a problem for one patient might not be a problem for another. And I'll give you one such example, acne scarring. Yeah. There are so many skin boosters in the markets in the United Kingdom, but not all skin boosters are created equal. Not all skin boosters will be able to treat acne scarring. And the ethical medical practitioner will choose the right tool for the right patient and won't be swayed by pressure from pharma to choose one product for that patient. And I think that's really important. That, again, that to me is professional integrity. So we've got a range of tools in our toolkit. We've got a range of different dermal fillers in our toolkit, but only the best, only premium, only rigorously tested and researched, only those products that have been around for a long time, that have gone through adequate testing and that we know has low risk of causing complications, that are easily dissolvable. Yeah. And again, this comes down to which fillers you choose for the patient. Not all patients are the same.
No.
But one thing that I would say to my patients is be mindful of that, and be mindful that there are fillers that you can buy for £14. I mean, you know this. We get all kinds of messages, don't we?
Yes, definitely. It's devices, products, wanting to send you things which we know aren't tried, tested, regulated. So it's a straight no for us. It's
a straight no. I mean, our phone, our emails are pinging my DMs saying, will you take this from China? I've got this new HIFU device for, I don't know, £1,000, whereas our HIFU devices cost tens of thousands of pounds. You can buy a cryolipolysis machine for £5,000. Our cryolipolysis machine, cool sculpting, cost £100,000. So our fillers cost in the several hundreds. There are fillers in the market that cost something like £15, and they can buy it off eBay. And it's actually really quite scary. It's actually really, really scary. And I see it and I think, oh my goodness. And patients don't know. They do not know the difference. And I have seen medical practitioners being falling for using products that haven't been appropriately and rigorously tested. Yeah. So safety comes first. Product choice is important. That's something that obviously we're really, really, I think, hot on.
Yeah.
And I would also say to my patients, be careful of the type of fillers, because they're not all created the same.
No, they're not.
Yeah.
They're not. And it is quite scary when you think about it. We had this discussion before that, you know, people could make fillers in their back garden, in a shed in the garden, and send them to you. And
literally,
that could be what's being used. They could make it in their shed with all the garden tools, a lawnmower,
bits
of grass, and you feel like ultimately that's what could happen, and that's been injected into your lips, and then that's where things like infections start, and all of these complications.
It's health and safety regulations. So dermal fillers are not deemed medical devices, and that is why they can be sold on eBay. But even non-CE marked products are kind of in the market. So one has to be aware of that.
Yeah.
And then permanent fillers. You know, I'm hearing of patients having permanent fillers, permanent fillers in their bums, permanent filler in their face, ending up with lumps, bumps, deformities. Be very cautious of that. Be careful of large volumes as well. Now, 1, 2, 3, 4 mils is not large volumes. It's nothing.
Yeah.
You know, 5 mils is 1 teaspoon of filler. So that's not a lot of product. But when we're talking 2 mils in a confined space like lips, or 100 mils in the bum, that's a hard no. That is a stay away from that.
That's a lot. Like we say to patients who will come to us, can I have it all done in one day? Yeah. And I'm often like, it's a journey.
It's a journey. You know, sometimes they can.
Sometimes they can.
And it depends. And again, it depends on what their starting position is. Sometimes we can do, especially I guess for my traveling patients who travel from abroad. We have patients from Australia. We have patients from America. For those types of patients who may only be able to see us in intermittent periods, then we might be able to place it a little bit more. But those patients who are local and might want it done a little bit more discreetly and don't want any downtime, break it up, do it over time. Slowly but surely, it's not a race.
But I think the important thing is we inform patients that, you know, we tell them why. And I've been in the room with you with patients explaining why you advise to only do this today. And I know if a patient is particularly nervous or worried, we often say, let's just slow it all down. Let's just take our time. Let's bring you back in and we'll do it then. And I know for obviously our international patients, they may have more, but they're informed that, you know, they could have bruising, they could have swelling. But we also have, you know, things in place for complications for patients who need aftercare. And we have a dedicated aftercare email. We have an out of hours phone. And that is all part of being a medical practice. We have those in place to protect our patients. And I know if we think we've got an emergency, I've been round to your house before now, you know, to get you sort of thing. And, you know, we will do anything we can to help patients opening the clinic late, staying late. I feel like we've been there till like 11, 12 at night once, dealing with a complication. And we do that because we care, not because...
you know, I remember that patient that you're talking about who had her nose done by an Insta-famous person who she thought was medical and wasn't, and then when she had a complication was blocked on Instagram. So this is why it's so important to do your research, you know, and understand that it's an unregulated environment. There are people who are injecting vitamin B12 with no medical knowledge or background, and there are pharmacokinetics and pharmacological concerns with injecting things that you do not need. So be very aware of that. Be very mindful of that. You are injecting a foreign body into your body, and it's vital that the person who's injecting it has the appropriate medical knowledge and prescribes it specifically for you. And also the premises. I mean, you talked about having filler made in your backyard. That is actually a thing that happens. You know, you can actually have injections in the toilet, in a public toilet. There's no regulation. And so when somebody calls their premises a clinic is a medical facility, and anybody can call their premises a clinic. But actually, our clinic is a CQC registered, Care Quality Commission regulated premises, and they're not all the same. You know how much we have a dedicated manager just for Care Quality Commission regulation, because it does mean that we don't cut corners, we don't buy cheap products, we procure our products from regulated pharmacies. They ain't coming from eBay, I can tell you that. They are kept at the right temperature. They are kept in a fridge, and the temperature of the fridge is checked. They are locked. I mean, there's such strict regulation from the
away,
everything from the moment it comes into the building to the moment it's injected into a patient is trackable. So that, you know, that costs. Ultimately, quality is going to cost, and it doesn't have to break the bank. And there are ways that we can, you know, we've got finance. We have 0% interest finance to make it accessible for patients, but ultimately safety comes first. And I think that's one thing that I would say is don't compromise on.
Yeah, definitely. And I think taking it back to like sort of going to places that aren't regulated, they may say they're injecting you with B12. Yeah. But how do you know that's B12? If they're not regulated, is their product regulated?
Yeah, you were telling me a story about this, right?
Yeah, most likely it's not regulated. It could be. I know that
fake stuff.
It could be fake. It could be, you know, it's important to know what's being used. And patients who will often, you know, our patients will say, we're taking pictures of the products, and they go on their files of everything. Should there ever be a complication, everything is logged down to the batch number of the product, what has been used, the amount that's been used, where it's being placed. Our notes they take time, they're in detail, they're in depth, and it's all to protect the patient.
Absolutely. Like you were telling me about the story about the vitamin B12 that was being injected into someone.
And it had no batch number on it, and no
expiry,
nothing. It just literally had B12 on the front. So, and it came from abroad. So that could just be water, or could be poison.
But it could be poison. It's come from a man in a black van. We've seen complications with Botox. I mean, botulinum toxin is another thing, and I think people need to be aware that there are risks. And you know, often we get emails saying, "How come it's £100 down the road and a couple of £100 at your clinic?" Well, that's because we procure proper products that are, again, regulated, temperature controlled, not travelled on the back of a donkey in Arabia and then given to somebody from a man in a white van
fell off the back, and it does happen.
You know, it happens, and it happens a lot, particularly in the area in Liverpool and also in Hackney in London. And I think it's vital that patients are aware that not all botulinum toxins are the same, that there is fake botulinum toxin going around, that they are full of bacteria, that they have caused abscesses in patients that are long lasting. And again, you know, botulinum toxin, We know that it can be used in the upper face, it can be used in the lower face, it can be used to lift the lower face. And there's off-label uses, but it can, even in the upper face, if it's injected incorrectly, it can create an asymmetry in the lower face, like the lady who came from Kurdistan who couldn't smile for 3 months. She only had toxin in her upper face, thought that it was such a simple procedure, and literally couldn't smile for 3 months.
Yeah.
And there are things that we can do to reverse dermal filler, but it can be very difficult to reverse botulinum toxin.
Yeah. Can you reverse botulinum toxin?
Great question. No, you can't. Okay. You can help to break it down a little bit using radiofrequency. If somebody, complications of botulinum toxin are different. You can, yes, get an infection if you've got fake product or a dirty environment. Very rare. I've never ever seen an infection from botulinum toxin. More common things that can happen. We say there's a 1% risk of facial asymmetry. There's a 1% risk of eyebrow droop. There's a 1% risk of eyelid droop. And then there's very, very rare risks like migraines and double vision that are transient and can go away. But if they have a asymmetry of the eyebrow, you can improve, or eyelids, you can improve it by adding more toxin into the other side, the contralateral side. You can also add it into the eyelids, and you can also prescribe eye drops.
Okay.
But the good news is with botulinum toxin, it's not a forever treatment. And what happens after time is the nerve sprouts new nerve endings and the movement will come back. So it's not as catastrophic as dermal filler, which injected incorrectly can lead to life-changing consequences.
Yeah. So Botox or botulinum toxin, should say, it's not permanent.
It's not permanent, no.
And I think that's something that is important for people to know, because they will often come back maybe after 4 months and say, oh, it's gone. My fillers, my dermal fillers lasted longer. Well, that is because it just does not last. It's
not a forever treatment. It's a temporary treatment. It can help with lines and wrinkles. It can help with migraine treatment. Yeah. Migraine treatment, we often get 6 months out of it. Yeah. Masseter reduction treatment, also 6 months. And also hyperhidrosis treatment can last 6 months. But with lines and wrinkles, we often see the nerve endings, sprouting new nerve endings, which means that usually after 3 to 4 months, you may need another treatment. But be mindful not to have it too regularly. The muscles of your face are there for a reason. They're there to express. They're there to tell a story. And actually overtoxing your face isn't a good look. Some of the complications of botulinum toxin placed incorrectly is Spock eyebrows, so eyebrows shooting up to the stars, over shiny foreheads that look really unnatural, plastic, fantastic, frozen look. And also eyebrow drop. So if you've put too much in the upper face is there for a reason. That muscle is important for lifting the eyebrows, particularly in women, and particularly women as they're growing older, I would say, try and stay away from having too much toxin in the forehead. That muscle is an important muscle that is key to lifting the eyebrows, and your eyebrows will become droopy as you age. That's natural. The muscle of the forehead becomes weaker, and the last thing you want to do is over weaken it. So I approach with caution. I often, as you know, we will use different types of treatments to help to strengthen the muscle and also to improve lines and wrinkles without botulinum toxin. It's not all about injecting your face with things. Sometimes there are so many non-injectables that we can do to help improve the aesthetic that are lower risk and that are worth considering as well. That's why, Sophie, sometimes you come to me and say, can I have toxin in? And I'm like, no.
Yeah, I remember asking about having my lips done before I got married last year, and you're like, no. I was like, I've got 6 weeks. You're like, no, you're not having them done. I was like, oh, okay. But I'm so, looking back, I'm so glad I didn't.
Yeah. Do you think we've scared everyone off?
Hopefully not. I'm sure they'll all come.
I think, as you say, knowledge is power. And this is all about empowering our patients to take ownership of their aesthetic journey, to understand what to expect, and I think to safeguard them as well. Yeah, that's the purpose of the entire podcast, really, is education and empowerment. So I think that it's vital that we end it with some guidance.
Yes.
My guidance would be, choose the right practitioner and understand that safety is very important, that not all fillers are the same, that in the United Kingdom, we are in an unregulated environment, which means, unfortunately, public health message is it does come down to you to do your research. Good practitioners do tend to have a waiting list, and that's okay. And one of the worst things that you can ever do is cut corners when it comes to your face. Know that there are risks no matter what you do in life. If you get in a car, there's a risk. If you go to, if you get in an airplane, there's a risk. No one's standing outside the airplane saying, by the way, this aircraft might crash, right? And that is what we're doing. That is what we're doing to our patients. Sometimes they come to us and I say, well, this can happen, this can happen, this can happen. It can be absolutely terrifying. But put it in perspective. Millions of these procedures are happening every single year without any complications. So I deem these procedures to be safe as long as they are in the safe hands, as long as complications can be appropriately diagnosed and managed quickly. And I think that's the crux of it, is knowing where to go and ensuring that, absolutely, ensuring that the right practitioner is putting needle to face, and knowing that not all fillers are the same. So don't be afraid to ask questions. Ask your practitioner questions. Ask them what they're using and why they're using it. Yeah. Ask them what will happen if they have a complication. Ask them what they're going to do to reduce or mitigate the risks. Know that there are risks. There are risks no matter what you do. Like I said, you dye your hair, there's a risk of an allergic reaction. And put it in perspective and make the right decision for you. And that might be having fillers, and it might be not having fillers. It might be having toxin, it might not be having toxin. But I stand by the fact that you pay cheap, pay peanuts. Unfortunately, you get monkeys. Yes. So be safe, be woke, beware, and let us know if you have any questions.
Yeah, definitely.
Thanks for joining, Sophie.
Thanks for having me.